Well, thank you, everybody. I'm delighted that you're joining us, however you're joining us, via Facebook or via Zoom. And thank you to the press who has joined us here on Zoom today. I'm thrilled that on this Friday, before I anticipate that the Senate will pass the American Rescue Plan, we have with us the governor of Connecticut, Ned Lamont. We have the mayor of one of our bigger cities, Harry Rilling of Norwalk, and we've got the first select woman of one of our smaller towns, the town of Trumbull, and Vicky Tesoro is with us. And the objective in the next 45 or so minutes is to try to make the very big numbers and abstract concepts like state and local aid clear and tangible for people. The reality is that the 1.9 trillion program that is being debated, it was passed in the House a week ago, it's being debated in the Senate right now, is full of a lot of stuff that is really important to continuing the trajectory of crushing the virus, as we're doing so well here in the state of Connecticut. And obviously we don't celebrate that yet because we're not where we all need and want to be. And of course, we've lived with the tragedy of thousands of citizens, of our fellow neighbors and community members and family members having succumbed to the coronavirus. So there's no celebration, but Connecticut has been able to really get the virus under control. And we are now at the very top of the stack of the 50 states in terms of the efficiency and the size of our distribution program. I saw a stat that we're actually number 2 in the country with respect to vaccinating veterans, and we're number 3 or 4 in the union in terms of actually just getting the vaccine into people, which at the end of the day is how we reopen safely. So I'm going to open with just a brief summary of what's in the rescue plan. Then I'm going to ask our mayor and our first select woman to really talk about what this means on the streets and the playing fields and the schools of Norwalk and Trumbull. I'm actually just back from visiting Rippewam Elementary School in Stamford that will be reopening on Monday of next week. And they are reopening because they got aid to help them with testing, to help them with all of the technology like special desks and plexiglass and that sort of thing that will allow them to reopen. And so I'm really going to ask our mayor and our first select woman to talk about what this aid means on the ground. And then, of course, we'll hear from our governor in terms of the very substantial amount of resources that are coming in directly to the state. To the state of Connecticut. Let me just take 2 minutes now to give a summary of the state of play. I've referred to the state and local aid that's coming. There's in the bill, and there will be some changes to the bill in the coming days. So this is not gospel, but at the end of the day, it'll end up looking a lot like this. In the bill, there is just shy of $200 billion of aid to states. Connecticut will get somewhere in the neighborhood of $2.75 billion as a result of that $200 billion in the COVID rescue plan. There is an additional $130 billion that is to be divided between cities and counties. Now, we don't have counties here in the state of Connecticut, or at least county governments. So those monies here in the state of Connecticut will be dispersed to our towns and cities. There is an additional, and this was an add in the Senate, $10 billion of critical infrastructure money that has been added to help with infrastructure that is about dealing with the virus. Another really critical area, and again, having just come back from the Rippewam Elementary School, there's $130 billion in this rescue plan for state education agencies for elementary and secondary school emergency allocations. This is about reopening our schools. It's about remote learning, but it's also about reopening our schools. I'm not going to spend, because this conversation is about state and local relief, I'm not going to spend a lot of time on the other stuff. There is a lot of other stuff out there. People will have heard that the $1,400 payment will be made to those individuals making less than $75,000 a year, phasing out up to $80,000 a year. There is $25 billion, and this is very good news for our communities, for restaurants. And a variety of other monies available for our shuttered venues. Before I turn it over to Mayor Rilling, what we're talking about here today is a combination of the monies that were passed in December, which are out there doing their thing. And in fact, maybe the governor will mention that I think in mid-March, we're going to see emergency rental assistance rolled out in the state of Connecticut. That's a result of the December bill. And of course, where we are with respect to vaccines as a result of the December bill. We're also talking about what is going to be signed into law, I hope, next week. So those are the big picture items that I think are going to affect people on the ground, in their homes, in their communities. Let me stop talking now and turn this over to Mayor Rilling, a good friend and a great leader in the city of Norwalk. Norwalk is not the biggest city in the state of Connecticut, but it's a pretty big city by Connecticut standards. Diverse, has its challenges, transportation and otherwise. But Harry, thank you. We really look forward to hearing from you in terms of how this aid has actually helped Norwalk and what you see coming down the path.
Well, thank you, Congressman. And also thank you for being an unwavering advocate for all the things that people need and really working hard, not only for the 4th Congressional District, but the entire state of Connecticut and certainly the entire nation. You are an acknowledged leader and one that we respect and admire for all the things that you do. And Governor, I'm honored to be on this panel with you. You've been such a strong leader during this entire pandemic. I've watched the things you've done. I've been extremely, extremely impressed. You've really had to make some very, very difficult decisions, but you made them. And that's the important thing. We appreciate that. And that's one of the reasons Connecticut is where we are today. Most visible government services come from the local level. The things that people see on a daily basis that they need and that they count on. And in order for the states to flourish, our local municipalities need to flourish as well. And we need to make sure that we can deliver services that the people expect. And when we have something like this, there are so many unanticipated expenses that it really impacts us on our ability to provide those services. Not only that, but when we have a pandemic, we have a significant reduction in our revenue stream at the local level. Well, for instance, we have a $400 million budget in the city of Norwalk, and we've trimmed it to about as low as we possibly can. Those are mostly fixed costs, our debt service, and the things that are just barely there for us to provide those services. But when we see increased expenses for our testing sites, for security and police overtime, when we have problems where people working for the city are quarantined or they contract the virus and now we have to hire overtime shifts. When we look at fitting out the offices when people are going to work with, as you mentioned earlier, Congressman, the plexiglass dividers, all the expenses that we didn't think, sanitizing our buildings, all those kinds of things that we didn't anticipate, technology so people could work from home. So all those things that happen in a city are at risk. 90% of our budget comes from property taxes. And many people in the city of Norwalk and around the country have lost jobs. They've had their revenue stream disrupted. They're going to have trouble paying those taxes. And, so we don't know in total what the future holds for us because, this is still unfolding. This bill called the rescue bill, that's the right term because we desperately need to be rescued from what is happening. To give you another example, other than property taxes that people might have difficulty paying, all the revenue we get from our beach use, city camps that we run every year, renting out our mansions and our facilities for basic events, permit fees that we normally get, all those things have been disrupted. So our expenses have increased significantly. Our revenue stream has been impacted negatively. And there you have a very difficult challenge in order to move things forward. So I'm excited about this. I'm hopeful that money that's coming in to the state of Connecticut and ultimately pass through to the city of Norwalk will be a huge help to us so we can get back on track, continue delivering the services that our people count on, make up for that disrupted revenue stream so that we can move forward. So I'm really thrilled about this. And believe me, like I said, local communities, not only in Connecticut, but all around the country have been significantly impacted by this pandemic.
Thank you, Mayor. I really appreciate that. And just so that the panelists know, apparently we're up fully live now, so we've got both the Zoom and the Facebook Live going. Welcome if you're just joining us, and I apologize for the technological issues, which I guess shaved off the first couple minutes of introduction from this. We go now to First Selectwoman Vicky Tesoro. Vicky, thank you for joining us. Thank you for your friendship and your hard work in this pandemic. Before we hear from the governor on this statewide perspective on this aid. Trumbull is a great town. It's not unlike a lot of towns in terms of its size and its suburban quality around Connecticut. So what is this aid going to mean to the people of Trumbull? How are they going to actually see this state and local aid in their day-to-day lives? I think you're muted there, Vicky.
I am.
Okay.
Famous, you're muted. Anyways, thank you so much, Congressman Hughes, for inviting me here today. And thank you. I'll echo Mayor Rilling's comments. Certainly thank you for all that you do for our residents of Trumbull and really for everyone in the state of Connecticut. You are a great advocate. Also, welcome to Mayor Rilling and to Governor Lamont. Governor Lamont, I thank you too for your leadership, your guidance, and your communication through these extremely challenging times, really for the last year that we've seen you as a regular on your press conferences, and we do appreciate all of your help. And we can see how valuable your leadership has been to Connecticut, because as Congressman Hughes said, we are certainly doing far better than other states in our case numbers and our vaccination rates. So really thank you so much for all that you do, and your administration as well. So before I begin my comments, because I always like to do this, I need to thank our first responders in Trumbull and everywhere, actually, including health professionals, police, EMS, and fire, because they continue to make daily sacrifices to keep us all safe. And I want to thank our Trumbull Health Department as they continue to provide services to our community. Actually, over 21% of our residents in Trumbull have received at least the first dose of the COVID-19 vaccine. And right now, as we speak, there's a clinic going on at Trumbull High School where over 800 people will be vaccinated today. So I want to thank them, as I always do. So as Congressman Hughes said, Trumbull is like many other communities in Connecticut. It really is a beautiful New England town. We have just over 36,000 residents, and we actually have the most recreational and open space per capita in the state of Connecticut. We have over 20 parks in our town, and we've set aside 1,600 acres of town land as recreational areas and open space. We have great amenities like a 27-hole golf course and many small businesses and restaurants, and our schools make Trumbull a community of choice. And I only say that because we really are like many other communities in the state of Connecticut and in this country. And just like all of those other communities and municipalities, this ongoing health and economic crisis is causing people in Trumbull to struggle, just like they are everywhere. So I'm really going to echo a lot of the things that Mayor Rilling said, because they hold true whether you're a big municipality or a smaller town. The role of local government is more important than ever. And that is true in Trumbull, as I said, as it is in every municipality. You know, of course, we are appreciative of all the funding that we receive from the state of Connecticut. But just like Harry Rilling, the mayor said, most of our taxes, property taxes, about 95% are paid by our local residents and businesses. And, you know, local government addresses everything from roads, safety during storms, the parks, the pools, the schools, the senior center, the health department, the library, sewer system, the transfer station, other major infrastructure needs, and so much more. That's why it is so critical, because it affects everyone's lives every day. So during this current fiscal year in Trumbull, we were actually able to give our residents and businesses a zero tax increase. But of course, that brings challenges to our budget for this coming year. We achieved that zero increase primarily by reducing expenses, and that was a difficult thing to do, of course, and also by taking money from our general fund, also known as that rainy day fund, which through fiscally conservative budgeting in prior years was in a strong position to do that during the pandemic. However, now, due to the loss of revenue this year because of the pandemic, many of our town departments, including we've lost over $1 million in interest income. We are in a difficult budgeting position for this next fiscal year, including not being able to fund certain departments fully. And of course, that affects all of our residents if that actually occurs. So it's not good budgeting practice, of course, to keep taking money from our general fund. That creates a funding cliff and can also create other budgeting issues. But without any added relief, we will take the necessary budgeting steps to help our residents and businesses who continue to struggle. And this means raising property taxes, because as we said before, that's how we pay our bills here. 95% or more comes directly from our residents. I don't want to do that, of course, so I'm really excited to hear that we may get some relief through this stimulus bill. So it's imperative that we continue to provide critical services to our community. Although some expenses were reduced during the pandemic because some programs just didn't happen, other fixed expenses such as insurance, pensions, and debt service continue to increase. Some of our critical services, as I said, will be in jeopardy due to the loss of revenue and other budget challenges created by this crisis. That is why this stimulus bill is so necessary to provide needed relief to our municipalities. This needed funding is really a direct pass-through to our residents and businesses, who, as I said, they're the ones that pay these taxes. So my hope as the Senate continues to discuss this rescue bill, that they'll include the state and local funding included in a bill that was passed by the House of Representatives. So again, I thank you for inviting me here today and to let people know what it's like to live in our small towns and our big towns. It's basically the same issues we're all facing. So thank you for all that you're doing to help us.
Vicki, thank you. Thank you, Vicki, Harry, thank you very much. This is about property taxes. In our towns and cities, budget gaps get closed by either very painful cuts, as you talked about, Mayor Rilling, or through raising property taxes. And it's obviously about our schools and first responders. It's now an honor for me to ask our governor, Ned Lamont, to talk a little bit about what this means for the state. There's a lot of words out there that maybe people don't really fully appreciate. The rainy day fund, it's out there. What's it for? If we don't get the federal money and the rainy day fund needs to be tapped, what does that mean for people? I'm delighted that the governor could join us today. Again, I said this at the opening. I say this with a great deal of humility because we've lived through the same tragedy here in the state of Connecticut that we have around the country. But the state of Connecticut has really been exemplary in following the rules, in doing the social distancing and the hard things, the really hard things that have had an economic impact on lots of people to really drive the incidence rate down. We're seeing that in our numbers right now. And I'm really proud of the fact that the vaccination program, again, is tops in the nation. And that's partly because the people of Connecticut are good people, but it's largely because we have a governor who has been clear, direct, honest, and practical about how he has managed this horrible, horrible year. So to hear about what the roughly 250 billion or so, close to 300 billion in the federal aid package will mean for the state of Connecticut, I'm delighted to invite our governor, Ned Lamont, to reflect on that for a bit, and then we'll take some questions.
All right. Hey, thanks, Jim and Harry and Vicki. Hey, Jim, to you and your congressional colleagues who stood up on this package and the previous packages, it's a big number, but these are unprecedented times. And I think what this bill, the rescue, represents is we know that our numbers are getting better. There's a light at the end of the tunnel. We're getting back to a new normal, but we're still going to be working through the long-term effects of this COVID crisis for not months, but probably years. And that's why the $1.9 trillion package gives us a few years to implement and make some real changes that we need to make and make sure that this is money that's invested, not just to heal the wounds of the day, but to make investments longer term. And look, Harry and Vicki know all too well our municipalities locked in on property tax. And let's face it, a lot of our commercial establishments took a big hit in the last 11 months in particular. Jim, you in Congress and this bill and previous bills have done a lot for small business, but the value of commercial real estate is going to take a while to recover. And that's part of what we're able to do so that our mayors and first selectmen don't have to raise taxes. And Vicky's talking about the first responders. My God, it'd be those very same people who saved us over the last 11 months who would be the first ones whose jobs we couldn't save if we didn't have state and local aid like this. And the state of Connecticut's in pretty well positioned compared to some of our peers. But I hate, Jim, hearing people say it's a blue state bailout. You kidding? I mean, Florida and Texas have just been decimated. They don't have a progressive income tax. Their energy and tourism gone. Alaska hit. So these guys would be digging out for a generation unless we provided the lifeline they need. And here for the state of Connecticut, working with our mayors and first selectmen, we're in a strong position to make sure that we don't have to raise taxes. And more importantly, we don't have to cut social services. In fact, we can add to the necessary mental and health and other needs that people have over the course of the next year or two going forward. And I just like to mention two pieces of the bill that I think are transformative and really important to me. One is what you're doing on daycare and childcare. Joe Biden said the other day that, women's participation in the workforce is at a 30-year low. And that only happened in the last year. And this is equality and opportunity and choice and, two-earner families necessary to stay in the middle class. So we cannot allow that to continue. That's part of our message about schools. And that's part of the message about the, hundreds of millions of dollars coming our way, thanks to this bill and the previous bill, to subsidize daycare and make sure that it's widely available. And all those single parents who otherwise might not be able to get back to work and get back to work, and give those kids a little better opportunity. Maybe many of them been isolated for so long to socialize and come back. And we were there 2 days ago, as you probably heard, with Jill Biden and Miguel Cardona, now we call them First Lady, and Secretary of Education, celebrating the fact that 99% of our schools are open and almost all of them open for in-person learning, most of them open for full-time in-person learning. But we have a lot of work to do. And this bill provides significant resources, hundreds of millions of dollars to the state of Connecticut, going to Trumbull, going to Norwalk. And it's for ventilation, it's for COVID-related expenses, but it's also to make up for a year that we want to make sure is not a lost year for these kids, especially these younger kids. So I'd urge you to take the money that we're getting from the federal government and use it in the broadest, most creative way. Be it school doesn't stop on June 20th. It starts again in July. And we get these kids back in the game. And social and emotional, not just a lot of STEM in front of the computer screen. What we can do to get apprentice teachers helping out. What we can do to get social and emotional workers there at our schools, starting up after school activities, internships. These are the type of ways that this money we're getting from the federal government can be transformative. So I'd like to make sure we make the best out of this tough situation. And Jim, thanks to the work you did and the rest of the delegation, we got to push hard on the Senate to make sure this bill passes as close to intact as possible, passes in the near term. So, it takes a month or two to start putting these monies to work in a productive way. But we can make a lasting difference for a lot of people who have been left behind, who might not be able to get back in the game. This money gives us the opportunity to help them get back in the game. And I think I'm speaking for about 49 other governors and a lot of mayors and first selectmen. What a difference it makes, Jim.
Thanks, Governor. Really appreciate that. Let me ask you to just elaborate a little bit. We have a couple questions coming in that I'll throw out there. But again, in trying to make this really tangible for people, you said something really important, Ned, about social services and mental health. This has obviously been a healthcare emergency. We've lost way too many of our fellow citizens. It's been an economic emergency. It's also been really hard on people. I saw this at the school I was in this morning. It's hard on kids who are used to being social creatures. It's hard on parents who, need to not just do what they do, but oversee their child's remote education. It's hard on people who live alone. We do have a huge kind of mental health challenge. We're going to be dealing with the effects of the traumatic after effects of this for some time. So Ned, talk a little bit about, you said social services, mental health. That's a big thing that the state does. What does that actually mean to people? Because I suspect that long after the economy is spinning along again, we're going to be dealing with some of the after effects of what was a pretty psychologically traumatic period for a lot of people.
Yeah, we called it quarantine, but this was isolation. This was real social isolation. And it was reflected in the calls regarding domestic abuse, the calls regarding opioid abuse, the ones that really broke my heart, Jim. And we took thousands of these calls from young people, just calling up saying, I need somebody to talk to. Many of them were not going to school, not socializing, not seeing friends for months and months on end. And the sense of desperation, and we had to make sure that there was somebody they could talk to, a welcoming voice on the other end of that line. So yeah, when it comes to our amazing not-for-profits, the social service agents, the counselors, all the folks we need, they need the resources to get the job done. And we've had thousands of volunteers step up as well. And we're going to try and build that platform as well this summer, because this isolation could leave scars for a long time, or we can build a stronger back.
Yeah, I wonder if either Mayor Rilling or First Selectwoman Tesoro wants to. You obviously see this very much on the ground in your towns and cities. I wonder, with respect to kind of social services, I don't just mean sort of the psychological effects, but hunger, because we've had a real hunger challenge. I don't know. Before we get to the questions, do either one of our town executives want to maybe just paint a more detailed picture of what we're talking about when we say social services?
Yeah, you want to speak, Mayor Rilling?
Oh, you go right ahead.
Oh, thanks.
And I'll follow.
I had a background in prevention before I became first selectman, so it's always on my radar. We have a counseling center in Trumbull that's sort of a hidden treasure here, but it's well used and it's been very busy for the past year, really. We will continue to make that known to people that the services are here in our community for them. And that's within our schools as well, because yes, kids are definitely social beings. We all are. And this period of isolation has been traumatic for many people. And there's been, unfortunately, some suicides. That number has increased, and that is a tragedy. That's really one that we don't want to have more of that happening. So certainly we have a very robust social services department in town, and our senior center as well who has been reaching out and providing services to our community throughout this pandemic. And that's only going to continue to increase, because this, we all know this is not going to be a problem that disappears even when everyone is vaccinated. As the governor said, this is an issue that is going to go on for years, and the impact will be felt for years. So those services need to be provided, and certainly this funding that we will receive, we hope will be able to be used in that way as well when it reaches us.
Yeah, this has impacted people in so many ways, and certainly the social emotional. I like the way the governor put it. It's isolation. It's not quarantine. I mean, people have been afraid to go out of their house, and that's going to leave that scar for many, many years. The other thing, we have recently hired a chief of community services. There's so many services available in the city of Norwalk and other places that people need to know how to navigate, how to get access to. So my chief of community services every Friday morning holds a meeting among all the social service agencies in the city of Norwalk, and determining how we can reach out to the public more frequently with better information, how we can provide the services that they need. The other thing is there tremendous amount in normal times. There's food insecurity in the city of Norwalk and other places. We do a food distribution every Wednesday morning, and I believe last Wednesday morning, this 2 days ago, we gave out nearly 60,000 pounds of food to people who come and drive in their cars. And it's heartbreaking to see so many people who are struggling to feed their families. So this is, as the others have said, this is a long-term process that's going to take a long time to heal.
Thank you, Mayor. I've got a couple of questions that have come in from the people who are watching us. Let's start with one that is important and obvious. Lisa on Facebook asks, thanks you for your work on behalf of Connecticut. What's the timeline and when can towns expect to receive aid from the bill? While our governor and two town executives think about that, let me start by answering that question because that's an important one. Looking back, just to give you an example, to two programs that I think are going to be really important to the state of Connecticut in the December bill. So this is not the bill that is being negotiated right now, but in the December bill, my office gets asked a lot about two programs. And remember, this bill passed in December that are still kind of waiting for their rollout because they're new programs. The first is the Save Our Stages aspect of the December bill. Billions of dollars that are available to venues, large and small. The largest venues, the big movie theater chains and that sort of thing don't qualify, but our community theaters, our nonprofit theaters, all of those performance venues will qualify. Unfortunately, the Small Business Administration, which has charged with writing the regulations and the procedures to get that money out, are not yet done with that. I'm told that because it's a brand new program, because the SBA is also administering the Paycheck Protection Program loan, so they've got a lot of work to do. We're probably talking, another 4-ish weeks before it's clear on how our performance venues get that money. Now, that's a brand new program, didn't exist before. That's very different, of course, than the money that goes in through the traditional mechanisms to help our schools. The other one I'll mention, just because I know it's important to people, and the governor may have some further insight on it, is that the December bill provided very substantial funds for rental relief. So the Connecticut Department of Housing has been working hard now for months. And remember, this is also a brand new program. It didn't exist. And then so you need to put in place the administration. What groups are going to put it out there? You're going to have very high demand. How is that all going to be administered? These are taxpayer dollars. So obviously you got to be careful about making sure that they're not wasted or turned to inappropriate use. I am told by the Commissioner of Housing that we should start to see the availability of that program in the middle of March. So I offer those two examples because people are interested in those two examples, but also for brand new programs, they're going to be out there in a period of 2.5 to 3 months. Now, the question is about the funds that are available in the bill that's being negotiated. So, Governor, we're talking about the roughly, $3 billion-ish that the state of Connecticut is going to get. Some of it direct aid to states, some of it going to our local education authorities. A good chunk of it actually going for higher education. So let me ask all of you to take a quick whack at that very general question. What's the timeline when towns can expect to see the aid that is part of the bill? Let's assume that it passes and becomes law at the end of next week.
From my brief experience with this stuff, the direct aid, the grants come first. So that $1,400 payment comes quicker. Maybe direct grants to small business, PPP can come quicker. But for example, the rent relief, the education you mentioned, Jim, we just got the guidance for that from the December bill. And then it's a matter of, municipalities come to us, they give us a list of priorities and things they want that money spent on. We can get that money back to you. So it probably takes, a couple of months. The rent relief, we want to move on pretty quickly. We got about $250 million under the last program, and Department of Housing, Celia, is working with landlords and tenants. So it's not simply a matter of sending out a grant, which would be quicker and easier. We're trying to put together a 6-month or a 12-month arrangement to make sure that people can stay in their homes or apartments, for the foreseeable future, not having to spend more than 30% of their income, but ways they can slowly come up and maybe the landlords give back a little for the long term. So those things take a little bit longer, but the direct payments can come a lot quicker.
Harry or Vicky, any thoughts on the timing question?
Well, hopefully as quickly as possible. We're all in our budget cycle right now, and we're making decisions that are going to impact our local communities. So the sooner we know what our revenue or what our allocation is going to be, the sooner we'll be able to make those decisions. But I hopefully, I mean, the governor said a couple of months, and I hope we can get that done in the next couple of months. It'll be a big help to us, a tremendous help.
Yeah, I would just, follow that same comment. We're sort of at the mercy of the federal government here, and hopefully the state will take care of us quickly if they receive the monies, because we are in our budget cycle. The sooner the better we know how much we're going to get, so we can determine and tell our residents what that means, translate it for them. So.
Thank you, Vicki. The other question we have before we'll take some questions from the press that is attending pertains to will any of the state municipal funds go to reopening schools? And I think the question is, there is in the bill about $200 billion in aid direct to states. Connecticut will probably get about $2.75 billion of that amount. And then there is a separate fund, $127 billion, which goes to secondary and elementary schools, $40 billion that goes to institutions of higher education. So I guess the question is, will that money go to reopening, and how do you all see it that way? I said this at the beginning, but since we weren't up publicly yet, I was just this morning at Rippewam Elementary School in Stamford, which is reopening fully on Monday. And yes, the aid went to that. I actually got to see these special desks that can be reconfigured. It's a safer arrangement than was traditional. A lot of plexiglass, a lot of technology had to be purchased. So I saw it in action in Stamford today. And I do know that Stamford, at least, and maybe the two executives we have here can comment on their own towns and cities, but in Stamford, the intention is to have elementary schools open this coming week, middle schools maybe a week behind, and then they're still kind of working out the timing and the people are a little bit more susceptible to the virus. And, also an elementary student stays in the classroom, same cohort, whereas high school students move into a larger cohort, which creates more added risk of spread. So let me shut up on that. But before we turn to questions from the press, any thoughts, Governor or Mayor for Selectmen, on the question of education?
I'll just say briefly, yes, the money goes to reopening or opening and staying opening safely. That's really important. But also the money is more broadly used than that to make sure that kids can make up for lost learning. So again, I urge you to think creatively how we can use that money. And Harry and Vicki, while it's going to take a while for the cash to come, the allocations, I think, will come a lot faster for our towns and municipalities. So you'll know how much money is coming to your town, pretty soon thereafter.
I notice we've got 15 minutes left, and I notice that we have a whole bunch of reporters now on the Zoom. So why don't we stop? And Jimmy, my understanding is that you will call on reporters. Let me just ask both reporters and whoever answers. We'll try to be as quick as possible so that we can get as many questions in this remaining 15 minutes.
Thank you. We'll start with WTNH. NBC Connecticut.
Are they able to unmute themselves, Jimmy?
Yes, all of our media outlets are panelists. So Fox 61. We'll make sure we're not having any technical issues, but WFSB. Hearst Media.
Jimmy, can we ask the host to actually do the Ken, did you unmute yourself?
I think so. Can you hear me?
Yeah,
We can hear you.
Okay, thanks. Sorry. Governor, do you anticipate the federal relief supplementing your budget or to get to the bottom line, or are you planning on full funding now, and whatever federal funding would be kind of in addition to that?
No, Ken, as we put together our balanced budget for the next 2 years, it assumed, just like Vicky was mentioning about the rainy day fund, it assumed that we'd either have to draw down about $1 billion from the rainy day fund or use, federal support. So this is good news for us. We'll be able to preserve the rainy day fund. And we think that some of this money is going to go to, supplementing our budget. A lot of it's going to go to not-for-profit schools and a lot of additional services as well.
Thanks. And Governor, when you came to your conclusion on the reopening, did you have were you consulting to people outside of government, or was it individuals or a group, formal or informal? Was there any state money involved in that?
No, there was no state money. I think what Ken's referring to is we announced yesterday that we were going to eliminate the occupancy limits on restaurants and stores, but keep in place, obviously, the masks and curfews. And we just worked with our informal group of healthcare advisors on that, Ken.
Can you name anybody in particular, Governor?
Well, outside of the folks you know in state government, I had a good conversation with Scott Gottlieb, who was former FDA commissioner. He's been opining on our opening plan over the course of the day.
Okay, thanks, Governor. Thanks, Jim.
Thanks, Ken. Jimmy, who else?
The Republican American.
Thanks very much. I'm just wondering, how much flexibility are towns and cities going to have in terms of spending any kind of COVID-19 relief money? I mean, it's, I don't know whether they can use it to supplement, operating funds, or they're just going to be required to cover COVID related expenses or costs.
Yeah, let me take that one, and if anybody wants to add. This is obviously still being negotiated, but in the House, our objective was to not be overly restrictive, right? So there's, the economic catastrophe, which accompanied the healthcare catastrophe, means that there were negative effects that you wouldn't necessarily predict. All sources of revenue have been compromised at some point or another. There's actually been a sort of surprising, as we've seen a migration of people out of the cities into, in particular, Fairfield County. There's been a surprising uptick in sales of homes and transfer fees and that sort of thing. But obviously, the story has largely been negative in terms of the way revenue sources have been impacted. And then there's been maybe unpredictable expenses. Yes, it's emergency responder overtime. It's massive quantities of personal protective equipment everywhere, libraries, town halls, you name it. And so the objective has been to make it as flexible as possible. And I do believe that it's pretty flexible. So it's not just about mitigating the public health emergency. It's also about replacing lost or delayed or decreased revenue.
Well, maybe the local officials on the line and the governor can comment on this. Many towns and cities have budget reserve funds of their own. So why shouldn't towns and cities, like the state, dip into their budget reserves if they need to? I mean, shouldn't this be means tested? And maybe, if Connecticut towns and cities are in better shape than, say, towns and cities in Virginia, maybe more money should be going to Virginia.
I can answer that, Jim, or try to answer that.
Yeah, please.
So we, as I said, and when I spoke before, we already went into our rainy day fund, our general fund last year for this current fiscal year, when we reduced to a zero tax increase. It's a dangerous road that you go down when you go into that fund, though, because you then create a funding cliff for the following year, and you may never be able to dig your way out of that. So, and there's also other issues that come from that. Once you go below a certain percentage based on your operating budget, you could get into credit rating issues with the credit rating companies, which could then cause you to have to pay a higher interest rate on your debt, which then is another increase to your operating budget. So you start to go into a cycle there that becomes very dangerous. And so, although, in my current budget, I have gone into the general fund again because I'm trying to not put that onus on our residential and business taxpayers, because as I said, they pay 95% or more of the property taxes in Trumbull.
Before we go to the next question, it was interesting. I didn't catch who it was, but the question was means tested. Inside the formulas for the allocation of this aid, there are any number of kind of means testing mechanisms. So, for example, let me give you an example. In the $130 billion that is there for cities and towns and counties too, but again, that doesn't apply to Connecticut. Rough estimates suggest that the city of Bridgeport is going to get in the neighborhood of $85 million. Compared to Stamford, which rough estimates about $25 million, even though they're roughly the same size. The reason for that, of course, is that social indicators in Bridgeport, levels of poverty, levels of kids on numbers of kids on reduced lunch, that sort of thing, are much higher in Bridgeport than they are in Stamford. So it's not just a simple per capita allocation. Those cities that have more intense needs will receive more monies than those that are more affluent and don't have the same needs.
WSHU. The Hartford Current.
Hey everyone, this is Emily Brindley from The Current. My first question, and I apologize if you guys talked about this at the beginning. I hopped on the call a little bit late, but I was speaking with some community health centers over the past couple of weeks, and they've talked about how the paying for the vaccination rollout kind of upfront for them has really been a strain on their budgets. So would somebody be able to talk a bit about how much money is going to be allocated specifically for those vaccination sites and those community health centers that have been standing up vaccination sites, and kind of how that money will roll out to them?
What I do know, Emily, is that, Josh and Deirdre over at the Department of Administrative Services and Public Health have been, working on the partnership we have with the community health centers. They've been amazing. They get vaccines directly, as you know, from the federal government allocated right there. But then we help them in terms of costs of administering this, and they're helping us out at Rensselaer Field and the such. And some of this money that Jim is talking about is federal support that we have to help our federally qualified health centers continue to vaccinate people.
And Emily, the specifics on that, and again, these numbers are subject to change inside the Senate. As you may know, $7.5 billion going to CDC for, amongst other things, the administration and the monitoring of vaccines, and just over $5 billion going to Health and Human Services for manufacturing, production. The idea being that even if a health center needs to front money forward for the vaccination effort, it should be reimbursable through one of those mechanisms.
Thank you both. And then I wanted also to follow up on a question that Ken asked a little while ago. Governor, when you were consulting people about your reopening plan, in addition to Scott Gottlieb, you said yesterday that you also talked to hospital officials. Would you be able to give any specific names of those people as well?
Yeah, I think, Josh Jabal talked to all the presidents of the hospitals as we thought about what we were doing. And obviously, we talk to them every week, regardless on vaccinations and just general hospitalization trends. So they were some of the groups that we talked to as well. And
so just to clarify, that would be like Hartford Healthcare, Yale New Haven, New Vance, anybody?
I think that's right, yeah.
Okay, thank you.
We have no further questions.
Great. Well, thank you for those questions. And thank you so much, Governor. I know you've got a lot on your plate, as do Mayor Rilling and First Selectwoman Tesoro. Really appreciate your help in making sure people understand how critical this aid is to doing what we've been doing pretty well here in Connecticut, which is getting back up on our feet. And I really thank you all, not just for participating, but for the remarkable work that you have done over the course of a really, really tough year, and the leadership that you've shown. So thank you, everybody, and look forward to continuing to working with all of you in the future.
You bet. Thank you.
Thank you.
Harry, bye, Vicki.